Welcome to the SmileLine podcast. The purpose of this podcast is to give real information from doctors and patients about our SmileLine prosthetic and the sequence of appointments. For more information, check out our website or give our office a call. Hope you enjoy today's episode. All right, guys, welcome back to the SmileLine podcast. Today, we do not have a patient in the chair. We have our surgical assistant, Abby Elledge.
That's me.
And we're going to do a fun new series for the SmileLine podcast. I'm going to try to convince as many of the assistants as I can. I'm not sure how many. To come up here on the podcast and just do a little get-to-know segment with them. Ask them a few hard-hitting questions. Test their knowledge.
Okay.
No, not going to be doing that. But yeah, so Abby, what's your background?
Oh, gosh. So, in dentistry?
Dentistry, personal, whatever you...
Okay. So, I started in dentistry when I was actually 17. I started working summers at an oral surgery clinic in Rolla, Missouri. I'm originally from Licking, Missouri, so that's a couple hours south. And I worked summers for them through high school until I graduated. And then after I graduated high school, I went to work for them full-time. Really learned a lot, found out that I liked dentistry, found out that I really loved surgery, and then I actually went to Surg Tech school, also in Rolla, Missouri, completed that, found out that I didn't really love working in the OR for several different reasons, and then came back to dentistry, worked in Rolla for a little bit longer, and then found HuntLine.
Yeah. So you originally went to school to be a surgical assistant, right?
Yes.
Like operating room, hospital, stuff like that?
Yes, correct. I have seen a lot of different types of surgeries, worked with a lot of different specialties, a lot of different surgeons, and it's great. I loved it. But I think the thing that kind of drew me away from that was all my patients were asleep, right? And I didn't get to follow up with them or,
no gratification at the end of
right,
like, hey,
exactly.
we healed you, we fixed you.
Yeah, I didn't get to talk with them and build that relationship like I do being here in the dental field. So yeah, it was kind of a drawback for me, and I don't like to stand in one spot, and I like to talk, and I like to move around a lot, so here we are.
Yeah, so you found out you didn't like surgeries, and you like dental more, and now you're back to assisting surgeries.
Well, okay, so I wouldn't say that I don't like surgery. I love surgery, but there was different aspects of like OR surgery that I didn't love.
Gotcha.
But I still love surgery.
Yeah, so then you came to HuntLine, and you started as a dental assistant, right? And so what were your first thoughts about HuntLine as you just came in as a newbie?
Well, I loved it. Everybody is very welcoming, very sweet, nice, and all the patients are very, very wonderful as well. They like to get to know you. They ask you all the questions. Yeah, and I started as Dr. Maddie's main assistant, so she was also new at the time.
How was that working with Dr. Maddie?
I loved it. We actually, I miss her now that I don't work with her every day. We got into a groove of things really fast, actually, and we've talked about it often that we could speak a language without ever even speaking to each other, so that was pretty cool. But.
Yeah, to follow up on that, I know sometimes I get thrown into assisting role about once a month, maybe once a quarter, and that unspoken language, Dr. Sam will just be looking / glaring at me, and I have zero idea of what he wants. I mean, he'll usually be like tapping something or doing this, and I don't pick up on any of the cues.
And I can probably just walk right past the room and be like, he needs this, or he wants this, or
no, right over me.
That's okay.
I don't get any of it. So you transitioned to Dr. Sam, but I kind of wanted to follow up on the general clinic.
Yeah.
What are your thoughts about our general clinic, and like whenever you were over there, how was your time? How do you think the patients were, treatment, etc.?
Yeah, it was great. It was actually a struggle for me to move from the general clinic to the surgery clinic. For that reason, I felt like, I mean, all the patients are great. Dr. Maddie is great. A lot of turnover. I mean, as far as like, we would see a lot of patients in a day, and that's good. I like that kind of flow, staying busy, helping as many people as we can throughout the day. Yeah, it was great. All the girls are great. it's great.
Yeah. So then a position opened up on the surgery side, and you joined the dark side, didn't you?
I did. Yeah, that's what we like to call it, I guess.
So then you started working with Dr. Sam on the surgery center and being his main surgical assistant.
Yes.
What are your thoughts about that? How was that transitioning from Dr. Maddie to Dr. Sam?
I was a little nervous at first, but overall, I mean, I seriously could not be happier. Like, I love it so much, and a lot of my patients, they tell me, my surgery patient yesterday, he was like, I can just feel that you love it, like you want to be here, you're very caring, you're very sweet, and I love that, and I appreciate that so much. But and a lot of our patients also will tell me, you and Dr. Sam work really well together. You guys have this, you're fun, you're vibrant, you make the environment way more comfortable than what we could have ever expected. And I think that's great. Like, we obviously want our patients to feel as comfortable as possible, especially undergoing, major mouth surgery.
Yeah, I mean, you guys are doing a very invasive surgery.
Yes.
It's the patients are usually pretty well sedated, but
Right.
like, it's uncomfortable. It
Oh,
takes
yeah.
a while. It's very invasive. So like, anytime you can crack a joke, make them smile, just make them like think like, oh, I'm not just sitting here holding my mouth open.
Right,
Like,
exactly.
makes it flow a lot
No,
better.
I love it. I could not be happier. I feel very fortunate to say this at such a young age, that I love my job and I love Huntline, and I'm very thankful to be here. So
Oh, that's awesome to hear, Abby. That's
it is.
awesome. All right, so you kind of seen, you've seen the general clinic side, you've seen the surgery side. What is your favorite procedure or aspect of assisting?
Well, now that I've done quite a few surgeries now, I would definitely have to say that the conversion part of it, the actual surgery appointment, is definitely my favorite appointment to assist as an assistant. There's a lot that goes into it, and it's kind of can be stressful sometimes, but I feel like it's the most, I don't know. it's the most important appointment, I
For
think.
sure.
And so
Why is it your favorite?
I love surgery. It's kind of it can get a little messy sometimes, kind of nitty gritty. Dr. Sam likes to say it's about to get Western, or we're about to have a rodeo or something like that sometimes, and I'm like, yeah, and then we both walk out of there, not to scare anybody, but we got blood and everything all over us, and we're like,
you pointed to your shoes
that was
earlier
fun.
this week. They had a little bit of splatter on it.
yeah. So brand new shoes.
Yeah.
That's okay.
Yeah. Okay, so now, you see, I usually see them for consultation, and then you get them for surgery,
Yep.
follow-up, temp phase. You're delivering these prosthetics now, doing the 90 days. You really take it, once the consultation's complete, the patient's seeing you primarily, and Jesse some, in all these appointments. What are your thoughts on our SmileLine process that we're doing down there at Huntline?
Yeah, so, I think it's incredible. Dr. Sam has referred to it as we're kind of like the unicorn of dentistry right now. I think it's amazing how we can take, a patient that is needing something like this and essentially give them a whole new set of teeth in such a short amount of time. And, as far as I know, it's going really, really well. So
Yeah, it is. We are more of a unicorn than most other practices, being that in 4 to 6 visits, you can go from your existing natural teeth to a brand new prosthetic.
Yeah.
In that few of visits, it's quite a bit cheaper than the national average, just because we are our own in-house lab, and we're very efficient with it. So it is really amazing what we're able to do for those patients.
Yeah, no, it really is, yeah. And it's very rewarding being one of the people that makes it happen for our patients. It's a very rewarding position.
It is.
Yeah.
I always joke, because I see them on the front end consultation,
Right.
Then I see them at the back end. They got their brand new teeth. They're smiling. They're happy. They forgot about surgery. They forgot about the healing. They forgot about all that.
Yeah.
And I kind of do too. I'm just like, that's just like all that magic happens in those appointments. But I don't really know what it. I mean, I know what it is, but like I don't see it on a
Yeah,
day to day. So I
yeah.
just see the before, I see the after. I'm like, this is awesome. But
Right.
there is a whole lot that goes on
There
in
is,
the operatories and behind the scenes in those 4 to 6 visits.
Correct, yeah.
There's a ton that the patients don't see. Even I don't see that happens on every one of these cases, and I think it's what makes us truly special.
Exactly. Yes.
And we're doing it
I
with
agree.
a team of, I don't know, 6 people,
Yeah.
5 people,
Yeah.
something like that.
Yeah.
It's a small team, but everybody's
It is.
paddling in the same direction.
Yeah, and I think everyone has that same, drive and want to make each of our patients better and give them the best outcome possible. And so I think that's what also makes us the unicorn of dentistry is everybody shares a pretty big passion for it. So
Absolutely. All right, you ready for some fun questions?
I'm ready.
All right, guys, we're going to get to know Abby a little bit better here.
Oh gosh.
Now, on these questions, you got to give me first thought that comes through mind, okay?
Okay.
No redos, no second takes, none of
Okay.
that. All right, what's your favorite, if you had to pick a favorite pet, what would it be?
I don't know. I'm not a pet person.
None?
No.
Walker?
Walker. Yeah. He's my favorite pet.
Okay, so no pets. If you had to pick a superpower, what would it be and why?
I think it would be the ability to read minds.
That sounds terrible.
I always want to know what everybody's thinking.
You don't want to get up here, Abby.
Yeah, that might be
You
true.
don't wanna get up
That
there.
might be true.
All right, so you might already answered this. What's your favorite dental procedure to assist on?
The surgery appointments.
Okay. Who did you vote for? I'm just kidding.
I actually no wait.
You don't
I
have
actually
to answer that one.
No, I actually didn't get to vote because I'm still registered back home. So I didn't get to vote because I would have had to drive 2 hours back home just to vote and turn around and drive back. But
It's okay.
I hope it speaks for itself
we
on
did
who
we
I
did
would
it we
vote
did it
for.
without you then.
Exactly. We won.
Do you have any siblings?
I do. I have 3. 2 sisters and a brother.
Favorite color?
Purple.
If you had to turn yourself into an animal, which animal would you choose?
Oh, a bird.
Why?
So I can fly.
What bird?
I don't know.
A turkey?
No.
Just bird? Ostrich it? They don't fly.
I don't know.
Favorite food?
Oh gosh. I'm not really picky when it comes to food. We eat a lot of Mexican, so
So Mexican favorite food?
probably.
All right. What does Abby's future look like?
That gets a little blurry sometimes. Hopefully I'm still here at Huntline. I mean, overall, I'd like to get married and have some more kids, but we'll see.
Okay. Yeah. Well, we definitely want to keep you at Huntline.
Yeah. No plans of leaving.
Yeah. Well, that's good. Well, guys, there you have it. We have now gotten to know Abigail Elledge. Thank you
Yep.
for coming on the podcast today.
Thank you for having me. It was fun.
And sign up for your SmileLine prosthetic, and you will get to know Abby a whole lot better, and she will get to know you as well.
I would love to have you as a patient.
All right. Thank you, guys. See you next time.